Portuguese and Spanish. So it's my first time teaching English, so please feel comfortable to ask me if my Latin accent sounds weird for you. Thank you very much. My idea is to talk about three main subjects regarding orthodontic aligners. And I agree with Dr. Vilmal and the people from Medit that orthodontic aligners are just in the beginning. A lot more things will happen next 5 or 10 years. It's just the start. And three highlights are important here for us. First, there is some idea around that aligners are able to treat only the simple cases, and that you need braces to treat complex cases. And this is not true. In Brazil, they found me, Dr. Clear Aligners found me in Brazil because Brazil is the biggest number of dental doctors in the world. We are kind of the country of the dentistry. Maybe because Brazilians are very connected with aesthetics, and we have a lot of research going on about orthodontic aligners, and it's been proven that you can treat any case with aligners, all cases. You can use aligners. And we believe strongly that next years braces will almost disappear. And this is true for me and my 2 clinics in Brazil. I stopped using braces 6 years ago, and we've been treating, and we have 1,000 cases treated only with aligners, a lot of brands of aligners. So the 3 highlights of these presentations are, first, any case, it is an aligner case. And the other 2, to get these complex cases and any cases treated with aligners, you need 2 things. You need a good plastic, and you need a good design of the treatment. You need a human brain thinking about the staging of the movement, thinking about the ballet, we call ballet for plastic ballet, because the behavior of the plastic are very different to make the teeth movement if you think about braces and plastic. So, and until now, until this year, there is no software able to plan a good staging of movement of the teeth. It is still necessary to have a human brain planning this. And if you have a good plastic, and if you have a good human brains thinking about the staging, you can treat in a fast, easy way, predictable way, any case using aligners. But if you have a good plastic, if you have, but if you don't have a human brain thinking, you can have the software, but if you don't have a human brain designing the treatment, you can use a good plastic. You can use even Smart Track from Invisalign, and you are not getting the result. You will need a lot of refinements. So this is the point that aligners industry is right now. It is important to highlight this because there is a lot of information and noise regarding this subject, and we people that are not inside in this subject can look aligners and think that everything is the same, but it's not. You need a team of doctors thinking in staging, and this is not being taught in orthodontic clinic, in orthodontic schools yet. This is not, this is cutting edge information, okay? And you need a group of good brains thinking in staging, and you need a good plastic. And we believe in the future, the unique thing that will dominate the market will be the companies that have these brains and these plastics, and of course a good delivery to the patient. So I'm here to talk about Dr. Clear Aligners because this company has the proposal to have this clinical team thinking about the staging and designing the treatment. Designing the treatment, I mean sit in the front of the computer and decide which movement will happen in each aligner. This is design of the treatment. And this is not ready in softwares yet, okay? There is no company in the world that can make it happen without a human brain thinking in this stage. This is the tricky point and the most important point if you want to perform the results and if you want to treat cases with less appointments, faster results, and good outcome, okay? And Dr. Clear's aligners, they have this team in Germany, training by me and other doctors to stage the treatment and plan which movement will occur in each alignment. And also we have a good plastic, because there is the plastic that are hard and you have the plastic that are more flexible. And the plastic that we are using is Zendura plastic. The Zendura plastic is very similar if you compare with SmartTrack plastic, that is the plastic from Invisalign. So if you have a good brand and you have a good plastic, you will treat any case with few appointments. And few appointments means good money, good result, and new patients being referred by the patients that finish the treatment happy, okay? Dr. Clear aligners, we are in 7 countries, and we have a lot of benefits to show you. So, but first, allow me to introduce myself. I'm Marina Lara, and I have an e-learning method in Brazil, and I've been teaching orthodontics and biomechanics and business management in dentistry. And we are working with Dr. Clear aligners, developing the team that are planning the clinical design of the aligners. And the journey of our treatment is very easy. First, we send the patient to you, to your clinic. You make the scanning, photos, clinical exam, and then send these images for us. We will design the treatment, plan the treatment, show to you, and the patient send to you, and send the aligners. The phase 2 of treatment and the phase 3 are very important because we will have the virtual appointments with the patient. So you are not alone with the patient. We will see the patient during the treatment in virtual appointments, making like a remote monitoring of the treatment. So this can feel very comfortable for you as a doctor because you don't have to be worried about the result or about the quality of the treatment. You will receive a fee for the appointments, of course, to make the IPR, to make the attachments, and our goal is reduce your chair time, reduce the number of the appointments. And the good part is we don't ask for exclusivity, so you can still perform your routine aligners that you already have. You can still work with your Invisalign and other brands of the aligners, but you can just open a new door to receive DCA patients in our clinic. And you can sell other treatments to these patients. Of course, you will receive the fee for the appointments of the orthodontic treatment, but you can sell other treatments. And this is very nice because also if you need, DCA can provide scan to the clinics. And we think and we know as a doctor that 95% of the patients needs some orthodontic treatment in some level. And if you have an alternative, not so expensive like Invisalign, for example, to offer to your patient, you can sell like a package with a lot of products. We know, for example, in a case like this, and I'm very happy here in a dental meeting, show some dental here, show some teeth here, because I was missing, see some pictures of teeth. So, in a case like this, for example, if this patient comes to your clinic, You need, this patient wants aesthetics and everything, but you need improve the bite, you need improve the balance of the bite in order to have better outcome. So you can use, for example, Dr. clear aligners in the lowers, and you can perform veneers or composite restorative treatment in the uppers. So you can sell a lot of things and open the mindset, the patient, that the patient needs to buy a lot of treatments in a whole package. And for example, in this case, also we treat with Dr. clear aligners in the lowers and veneers aesthetic in the uppers in just a few months. So a lot of patients, like 70% of the population, has some problems in lower incisors. So this is very, very, very common. And if you have a periodontal problem, you need first improve the position of the teeth. So dental alignment and position of the teeth are important for any kind of treatment, aesthetics, prosthetics, periodontal treatment. And if you have an alternative that is cheaper and so good and fast, like Invisalign, but you're not expending too much money and not expending much money from the patient, it is a good alternative to offer to your patients, and then open the door to the new patient that we will send to you. Even gingival resection you can treat with aligners. If you have a team thinking that you need to move the teeth inside the bone. Any kind of treatment, you improve the outcome if you improve the position of the teeth. I agree with Dr. Vilmau about the relevance of aesthetics. We in Brazil, we used to say and talk a lot that it is improving, that a good smile can improve your business. A good smile can make you look smarter, can make you make better connections in your professional and personal life. And people that doesn't have good smile looks worse. This is a very hard truth, but it is. And in treatments like with a lot of wear and bruxism, that is very common here in the pandemic world, patients are just destroying their teeth. You need first correct the position and then make the treatment. So you can just correct the position with 10 sets of aligners, and then you have a lot good things. And now I would like to present a new technology, the Dr. Clear X aligners, the 4D aligners. This is very new and very exciting because it is the German technology, and it's something very fun. Patients love this idea to put their aligners inside a booster. Works like that. In the regular aligner treatment, you change the aligner to change the movement of the teeth. But in 4D aligners, you will not change the aligner. You put the aligner inside the booster, and the booster will change the format of the aligner to the next position, to the next step of the treatment. So the aligner change his format, change his anatomy, the aligner, and then you put in the mouth. It is a treatment that is 35% faster. It is a new technology, a new kind of plastic, very flexible, and this plastic inside the booster will change the format to the next. So instead, the patient change a regular aligner each week. In 4D treatment, the patient will change each 3 weeks. So the patient will use 1 week inside the put the booster, second week put the booster, and then change in the third week. And patients love this booster idea. It's a very Instagram idea, and also it is a very effective idea because save plastics. It is an eco-friendly idea, and save money, of course, from the patient and from us. So the main points to make a summary of my presentations are: first, please think about stop doing braces and think about moving everything to aligners, and believe it is possible, it is real, and will happen. And if you don't start to think this, someone in your city will, and maybe you will lose space, because aligners can treat any case. In Brazil, there is a lot of clinics on doing only aligners in any case. But to use aligners in complex cases, kids cases, implant cases, you need two things. You need a good designing of the treatment, which is the tricky and most important thing. Some with a good brain that understand to make the staging, to define which movement will happen in each moment. And you need a good plastic, okay? Good plastic, any case, good brain. It is far from artificial intelligence make it happen, because it is a lot of complex things to think. For simple cases, the artificial intelligence, it is okay. This is the reason that everybody used to think, no, aligners works only in simple cases. Yes, because you are just pressing enter in your computer, and the robot, the artificial intelligence, even Invisalign artificial intelligence, are too far to have good result in complex case, okay? And we bring the patient to you. You will have zero customer acquisition cost, and I think this is the very important thing, because for example, for us in Brazil, if I put Invisalign in my Google announcement, it's very expensive, because online technology, for example, is putting a lot of money to buy the word in the Google ads. So the cost of acquisition, the client acquisition is very high, and it is getting worse. So if you have a door open for us send you a new patient, it is good. It is good, and it is very cheap. And you can offer other treatments to this patient. We have our clinical team making the designing of the treatment, having all the concerns to make the treatment happen, and make it happen in a fast way with low time chair and in a low appointments way, with few appointments. And you can perform pre-prosthetic alignments, and allows you to sell other treatments and to keep doing your business with other companies that aligners that you have been using until now, okay? So I'm very happy to be here again. I'm very happy to know Singapore, and I'm loving this place. It looks like Brazil, actually, the trees and the nature. And I'm available to answer any question and to talk to you. Thank you very much.
Marina, thank you very much for that. Brilliant, everyone. Well, that brings us to the end of the opening conference for today. So if you'd like to make your way out to the breakout room where the today's meetings will begin.